de la Sorbonne de Paris pour ce grand colloque européen, la formation, la recherche et l'innovation de l'Europe en santé. Je salue d'abord le public.
European Symposium on Training, Research and Innovation in Health in Europe. And I want to extend a warm welcome to all those of you who are here on site, but also all those of you who are following remotely. And feel free to ask all your questions using the chat box. We'll make sure to answer all your questions.
Vous en reparlerons, fera l'objet de l'appel de la Sorbonne. Le grand colloque est placé sous l'égide.
Symposium will then be part of a big round table, but we'll tell you more about this later. And I'm going to ask Bruno Rioux, the Dean of the Medical Faculty of the Sorbonne, to join me on the stage. And I want, of course, to extend a warm welcome to Olivier Véran, Health Minister, and to Frédéric Vidal, Minister in charge of Higher Education, Research and Innovation, as well as to Othman Nasrou, who is the Vice President of the Regional Council for the Paris region. Over to you, Bruno Rioux.
Bonjour à tous.
Good morning, everybody. It's a great honor for me to welcome you in this prestigious Amphitheater, this big lecture hall, in the presence of both our ministers, Olivier Véran, Minister in charge of Health and Solidarity, and Frédéric Vidal, Minister in charge of Higher Education, Research and Innovation. I want to speak on behalf of the Sorbonne University, speaking on behalf of Jean Chambaz, who was my predecessor and who retired. I want to thank Christophe Guerreiro, the University Chancellor, for welcoming us in this beautiful historical building. This symposium is dedicated to training, research and innovation in health in Europe. It is of paramount importance for me as well as for you, because I think there's over 1,000 people following this, either on site or remotely. After this difficult time that we've gone through with COVID, and of course it's not over, health challenges have become more important and pressing as we try to look into the future. I was reading in Le Monde, a newspaper, the headline was about research, and the headline was precisely the reasons behind the decline of French research. But having said that, there was a subtitle which was about how to bring back some new life and light into research. Who can foresee that we can rise to the challenge that the future has in store for us without innovation? And to innovate, you have to research. And to that end, we need to train the next generation of researchers. We are going to talk about training, research, innovation in Europe. This is how we want to bring back some life. And I wish you a very pleasant and fruitful symposium. And without further ado, I'll give the floor to Patrice Diot and Manuel Touran de Lara.
Monsieur le ministre des Solidarités et de la Santé,
Minister,
de l'enseignement supérieur,
Madam Minister,
Monsieur le vice-président de la région,
Mr.
collègues,
Vice President of the Regional Council, dear colleagues, dear students, dear friends,
bienvenue à ce
welcome
deuxième
to this
colloque
second
sur la formation et la
symposium
recherche.
on
Monsieur le
training
ministre,
and research.
Madame la ministre, il y a à peine plus d'un an, je vous
Minister and
rappelle,
Madam
vous me
Minister,
rappeliez
less than a
d'ailleurs,
year ago, and you
nous
reminded
nous
me of
retrouvions
this,
dans ce même
we
amphithéâtre,
actually
et vous
met
ouvriez un
in
premier
this
colloque
lecture hall,
sur des sujets qui étaient
and
quand
you
même déjà des
opened
sujets
a
de
first
formation et de recherche,
symposium
mais
with, on
au beau
topics
milieu
that
de
were
la crise
related to
sanitaire, alors
research
que
and
nous étions
innovation. So it
confinés,
was in the
donc,
middle of
en
this health
présentiel,
crisis, and
très
we were
restreint.
still either
Nous
in
avions abordé le
lockdown
sujet
or
dans
with
une approche
health
hexagonale. Mais nous
restrictions,
savions,
and
bien sûr,
we
qu'il
looked
fallait
at
élargir le
these
regard.
topics
Et nous l'avions
on a French
annoncé
scale, on a
au terme
national
de
scale,
cette
but we
première
were well
journée.
aware that it was on a European
sanitaire nous a
scale that we
montré
needed to
combien
tackle
les sujets de
research and
formation, de
innovation.
santé
This
en
health
général,
crisis
et
has
de santé
demonstrated
incluant
that
la formation
health
et la recherche
issues
dépassaient les
in
frontières,
general,
comme le
but
virus,
also
d'ailleurs,
issues
et
having
devaient
to do
être
with
abordés
research
de
and
façon
innovations. They know
globale.
no
Ce qui nous a
frontiers, they know
amené,
no borders.
conférence des doyens de santé et
And
conférence des
the
présidents
conference of the deans
pendant que je m'exprime,
of
à concevoir ce nouveau colloque
medical
avec
faculties and the conference of university
résolue
chancellors got together, determined to bring prestigious universities such as La Sapienza in Rome, the one in Leuven, Humboldt University in Berlin, and I want to extend a warm welcome to our colleagues from those European countries. The organization of the symposium has tapped into the strengthening of our relations. These links and connections already existed, but they have been strengthened because we share the same vision for a European health policy with a big chapter dedicated to research, training, and innovation. 1,000 people have enrolled in this symposium. Of course, unfortunately, only a minority of them can be on site because of health restrictions, but fortunately, all the others attendees will be following remotely. I want to thank partners of this conference of deans of universities, the conference of general directors of hospitals and teaching hospitals. I want to thank also our local governments in the Paris region and in the city of Paris. I want to thank also the MGN, and I want to thank Minister and Madam Minister, your ministries, without which we could not have organized this symposium. I will talk about training because my friend Manuel Tunen Lara will now touch upon issues related to research and innovation, and I thank you for your attention. Minister, Madam Minister, dear Frédéric, Mr. President, Mr. Dean, dear colleagues, dear friends. As Patrice said, this is a seminal moment. We had launched this series of symposia last year, and we are very attentive and sensitive to the fact that you came, that both of you came, Minister and Madam Minister. We think that the fact that you both came has a meaning and sends a message, because we think that the future of our country will be part and parcel of what we make of research, innovation and training in the short term, medium term and long term. We have to widen these fields and break silos. We can no longer think up health policies or the future of health without taking a multidisciplinary approach. based on a robust and ambitious research and innovation. We think we have to draw inspiration from all of Europe, bearing in mind that as of January the 1st, France will be holding the presidency of the EU. As Patrice say, we don't want this symposium to be a one-off. We want it to pave the way for strategic guidelines and a full-fledged strategy and policy. This is what we've decided to call this appeal, Sorbonne appeal. So we want to strengthen this common approach to health with our European partners. Minister Olivier Véran, Minister in charge of Solidarity and Health. It's always quite spectacular to be here in this beautiful lecture hall. I remember vividly being here last year, Madam Minister, dear Frédéric Vidal, Mr. President of the Conference of University Chancellors and Mr. President of the Conference of Deans of Medical Faculties. I, of course, see a lot of familiar faces in the audience. Deans of universities and people from the management of hospitals, but also people from Grenoble, which of course is dear to my heart. There are gaps in life expectancy across Europe that can be as high as 10 years. And in terms of child mortality, there's a ratio of 1 to 5 to 6. These gaps, these discrepancies make us dizzy when we talk about a European health policy. Health, as defined by the WHO, is about working towards the well-being, about lengthening life expectancy, reducing neonatal mortality and child mortality. These gaps have to be filled. We can look for the reasons behind them, but I consider that it's the system of social protection and health insurance that is what we need to work on. The countries that have the highest life expectancy are the ones that can rely on a statutory public-funded health insurance. So unless the countries that do not have that system inject a lot of money, these gaps cannot be filled. I was trained in Europe through Erasmus, dear Frederick, around Barcelona, in Tarragon, to be precise. I really believe in Europe, and I cannot be content with seeing such discrepancies in terms of health and social protection. So we need to tackle this. And I've been fortunate, if I can put it like that, since I've started my term of office, is that these health crisis has been a sort of a crash test for Europe in the way it tackled this health crisis. And maybe I'll give you the lay of the land to start with a bit of history. I was appointed in February 2020. A few days later, Italy was hit. Lombardy shut down, and the first few lockdown measures were taken. Schools, for the first time in Europe, were closed. Europe was in a daze and looked at how Italy managed to go on functioning. I rushed to Rome 10 days after being appointed minister. And beyond the European component of my approach, of course, it was as a neighboring country. We had also invited people from Switzerland, from Germany, even from the UK. And I remember seeing the Italian minister. He looked very tired. I think he hadn't got a lot of sleep, and he told us about the hospitals in Lombardy that were near saturation, even though hospitals in Lombardy, you have to know, are very well equipped. And he said, I heard from all my contacts that all the accident emergency, the emergency departments were completely overwhelmed, and that has led to us making taking drastic measures. And the German minister said, so when can you foresee lifting these restrictions and reopening schools? We were all taken aback and surprised. And it is ironic that during that summit in Rome, 3 of my counterparts got an SMS. Those were ministers from Austria, Germany, who first learned that cases had been detected in their countries. So we agreed not to shut borders because we agreed that virus circulation was not linked to borders. We also agreed not to take drastic measures in terms of shutting off public services without advising one another. And we agreed that we would also give a common statement. Shortly afterwards, Spain took some health restrictions, and some other decisions were made, and that agreement to keep each other posted and to take a coordinated approach was very short-lived and ended there. And out of the 27 countries, there were 6 or 7 countries who tackled COVID in the next European meeting we had. And I personally wanted to only talk about COVID, but some of my counterparts from Eastern Europe actually didn't want to talk about COVID at all. And I was taken aback, and that got me thinking, can there be a European approach? Is there a European awareness? And I learned that in Brussels, there were some high-ranking civil servants who were tested positive, and people were growing worried. And so we had to think how to fight the spread of the virus. And Europe, after a while, tackled this. We made sure to exchange epidemiological data, and this, of course, has to do with research innovation, follow-up indicators, and we tried to share indicators that seemed most pertinent. The CDC, which is the European Center for Disease Control and Prevention, which I think I can safely say can really be improved and perfected. And we decided together to coordinate so as to lead major projects. The one that has really developed greatly and satisfactorily is vaccines. BioNTech is a German company that then signed an agreement with Pfizer to develop that vaccine. There was an British vaccine, AstraZeneca, so there were European vaccines. And we decided, at first we decided that 5 countries decided together to sign contracts with the laboratories. And these 4 countries signed a first template contract with the AstraZeneca lab, which seemed to be the closest to bringing a vaccine on the market. And then we went to the European Commission that looked at the contract, and that made it possible for us to order vaccine doses, and all vaccines that were susceptible to come on the market. We made sure to order doses. Europe is the only continent that exported 50% of the doses outside of Europe. You know that a lot of criticisms were made on our capacity to order a sufficient quantity of vaccines, but after a while people realized that European coordination was what made it possible for us to be efficient in the way we might protect European population. This is what I want to be the take-home message here. We learned to grow together, to work together. We realized that we could not work in isolation on a European scale, that we had to work together and make progress and call upon each other and call one another in check if need be. And as of January the 1st, France is going to hold the EU presidency, and there's a number of challenges that we want to tackle in terms of health. There's the HERA agency to really build on the capacity that we have developed for emergency response with a legislation package that will be passed. Then innovation in health with the building in the different states to strengthen our tools for steering health policies, and also really a mutualized, pooled approach. I'm thinking of research on pediatric cancers. It would be a complete illusion to consider that France, in isolation, should develop ambitious research programs without taking into account what's happening in the other countries. It is in our interest to do things together. I'm thinking of genome therapies and many other fields. And I can feel that there's a political will, a strong political will to do things together, to be coordinated. We looked at antibiotic resistance. There's not a lot of talk about it, but there are thousands of people who die every year in Europe because they've grown resistant to antibiotics. And proving able to develop research and innovation in that field will meet across Europe will make it possible for us to really shed some light and put the focus on antibiotics resistance, but also for the health of European population to progress. And this is happening at a time when people are growing also hesitant, if not distrustful of Europe. Health is, of course, what's most precious for all of us, and Europe cannot disregard the health-related topics that, of course, are part and parcel of our daily life. I don't want to be too long. There are many other challenges, and, of course, I've completely lost the thread of the speech that had been prepared for me. But having said that, maybe it's better to share feedback, and rather than giving you the typical institutional speech. I'm thinking of digital technologies. There have been challenges. We've made progress. The health pass has been created and made operational very quickly and with interoperability. That happened very fast. And our health pass, that makes it possible for you to travel by plane or to hop on a train to go to Brussels or Madrid, goes to show how we can prove able to develop coordination tools, and how we can share data. It is on a European scale that we have to also think of digital technology, nanotechnologies. We are the European leader in France, even though, of course, we cannot yet compete with the US or China, but we've contributed a great deal to the rest of Europe. And genetic therapy as well. We have to do all of that in common. Other challenges that I want to talk about, and I think it is One Health approach, which is considering that there cannot be human health without looking at environmental health and animal health as being one and the same thing. And there's a lot of European cooperation in the making, and France will play its part in it. And there's another challenge that I want to touch upon briefly, which is the nature of information. And a year ago, when I was here in this beautiful lecture hall, I tackled it. Not only France is moving from a society based on reflection and debate to a society based on knee-jerk reactions and unbridled social media. I'm thinking of what I call the society of algorithms with no regulations. Talking about regulation of social media is not a foul word. This does not make us a dictatorship. This does not impinge or infringe on anybody's freedom. Let me remind you that it took a few months to legislate on freedom of the press, and nobody, of course, can regret that law on the freedom of the press was passed. There are extremely powerful tools that can make it possible for you to see what you're not supposed to see and not to see what you need to see. So we need to make headway on the regulation and legislation on this. I talked about vaccination already, but I've been too long, so I need to wrap up, and I apologize for being too long. I truly believe that a European health policy post-COVID-19 will have nothing to do with a European health policy pre-COVID. It's not about our capacity to coordinate. It's not about and I think it will be radically different from what we've known pre-COVID in terms of Europe-wide coordination, in terms of investments, and about including each and every European citizen.
Well, we all need to think and rethink all these issues. And now I'm turning over to Frédérique Vidal, French Minister of Higher Education, Research and Innovation. Madame, you have the floor. Thank you very much. Dear Olivier, dear Minister, ladies and gentlemen, members of Parliament, President, Rector, President of the Conference of University, Presidents, and Mr. President of the Conference of Deans of Universities, Presidents of French and European international universities. Dear friends, ladies and gentlemen, it is a great pleasure for me to be here with you this morning to speak about training, research and innovation as part of a European health policy. Olivier has just reviewed this ongoing development and construction of a European health policy with respect to healthcare, with respect to vaccination, and lots of other stakes and challenges. What I want to focus on is the building blocks for training, education, research, and innovation for a European framework health policy building on European university work and the development work which has occurred in the academic world. Manuel Tunon de Lara said so in his introductory remarks. Medicine and healthcare of the past has to be rethought. We have to embrace such issues as digital technology, as ethics. So we need to bring together all research capabilities around health as an issue, as a holistic topic. This is why we've promoted holistic health projects around infectious diseases, connecting it with climate issues. We can see that many aspects in research and sciences have brought us to focus on human health, on animal health, on the health of the planet, and this will help us to push things forward. So yes, indeed, France did not participate in the development of a vaccine, but French research is not under decline due to this. What has been under decline for the last few decades is with respect to investments in research, and this is why the French government has decided to massively reinvest in research. But our academics, our researchers, our medical and research discoveries have enabled us to keep a leading role in this pursuit of knowledge around COVID-19. We need to recall that the first sequencing of the viral genome was done in France. The understanding of the mechanisms which have made it possible to identify severe forms of virus contamination were produced by French pharmaceutical labs. And France has been owning up next to the counterparts in the various countries, promoting an open science project. This is the program which fits within Horizon Europe, which is the largest funded program for research in the world. And it's a source of pride to realize that no other continent, no other group of nations has decided to fund research to such a high level, from financing to basic research, from financing to the pursuit of innovation, to the delivery of innovation. These are the building blocks of the Horizon Europe program, as well as the various missions and assignments linking up knowledge and science and societies and society at large. So we, as intellectuals, academics and researchers, need and have to reinvest the public agora and rethink our relationships with society. And health is of critical importance, showing and telling how research, with its mix of produced knowledge, only aims at serving progress, including progress in human health. With respect to research activities, we can cite a number and mention a number of consortia which developed and were set up during the COVID crisis. I'm fully convinced that the COVID pandemic made it possible for us to develop new ways of doing things, new forms of cooperation, and we can leverage these new forms and take advantage of this. Building up a higher education European framework involves the dedication and involvement of European students, and the Erasmus Plus program doubled its budget to enable more young Europeans to engage in this experience. And it is possible for students of medical sciences in Europe, for both the undergraduate and the graduate studies, so that we can build up a European framework and policy for medical students and studies, and it is important that we start working right from the undergraduate level of the medical studies, and this is why I will be promoting these programs for both the undergraduate and graduate pathways. And European universities have thought through this holistic health, this One Health approach, and I have in mind EU GLOW, which is promoted by the Paris-Saclay University, which aims at developing training, education and research programs around health and healthcare, building upon European alliances and partnerships. So I would be delighted that a second Appel de la Sorbonne is sent out following the speech by the French President of the Republic calling for setting up these European health universities. The notion of innovation is tabled, as well as the notion of sovereignty during this crisis has been tabled, and we need to move forward without any naivety and while pushing forward for innovation. And innovation is basically an approach of trial and error, as is always done in research. So we need to stop thinking that innovation involves top-down approaches and that you always succeed and need to succeed the first time around. But innovation is based on failing and failing again before you succeed. And the health and healthcare market is a gigantic market in Europe and the European Union. It is of great importance that we ensure equal health and healthcare opportunities. And Olivier Véran said in his introductory remarks spoke about the very large inequalities across European member states, and anything which can be done with respect to health and healthcare, with respect to innovative approaches, products and services inside the European Union has to be shared and made common, and because health and healthcare is something which needs to be shared and made common. And similarly to the French President of the Republic, which called for, initiated this sharing mechanisms for vaccinations, making it possible for the European Union to deliver vaccines to a number of countries the world over. Well, we need to think and rethink the new sharing mechanism for the health policy and healthcare. So higher education, mobility of students, mobility of researchers and professors, the ability of jointly developing innovation falls within and builds upon the universities, with the universities owning up to higher education, research and innovation mechanisms. And this is why European universities need to help us gain better knowledge of each other, develop better forms of cooperation, and building up these European health mechanisms, developing training and education in the health sphere. And these goals are important for Europeans, call to the hearts and souls of Europeans, and it will be a way as humanists and as Europeans to develop a vision for the future which will drive optimism. It is very important in today's society to be able to drive this higher degree of optimism. My conclusion, as was Olivier Véran's, will be to refer back to the enlightening. It is our collective responsibility in the sphere of health, in the sphere of research, in the sphere of education, higher education, in the sphere of innovation, to be able to deliver the voice of science, of fact-based scientific freedom and debate. The French President of the Republic started the Runner Commission last night, which will be working on all these challenges and issues. Digital technology, among one issue, which is a great way to share knowledge with the assumption that truth would be given. Well, digital technology today has to be better understood, has to be rethought, so that we understand how digital communities are set up and develop over the social media, and how some of these communities decide and make the choice of rejecting discussions, rejecting common and shared understanding, and basically basing their analysis and judgment in a very unilateral manner. So it is important that we call for greater openness in the disciplines to understand these mechanisms and phenomena. Pessimistic messages and negative messages are spread 17 times more than positive or neutral narratives and messages. So when one uses search engines to get information on climate issues, you have one possibility out of two to get a climate skeptical piece of information. Intellectuals and academics and researchers need to make sure that the voice of truth, the voice of knowledge and science can be heard loud and clear. All opinions, of course, are to be respected and are respectable when and if they fall within the state of law. And there's something above opinions, which is knowledge. And all of us at the level of France, at the level of Europe, have to live up to this. And this is what it means to revive the the century of enlightening, and to go back to its values. Thank you. Thank you, Madam Minister. We now give the floor to Othman Nasrou, who is Vice President of the Paris Regional Authority in charge of higher education and research activities. And before this role, you occupied the role of international affairs and European affairs. And so you are very knowledgeable about the issues at hand today. Thank you, everyone, Madam, Mr. Minister, presidents of the conferences, of the university presidents, of the medical deans of the various universities, university conferences. Through you, I want to greet all the practitioners and professionals of health and healthcare being with us today in person and remotely. Members of parliament, ladies and gentlemen, dear friends, it's a great honor and privilege to be here in this auditorium of the Sorbonne University. On a personal level, to be here in this venue, a great place for French knowledge, know-how and history. And I want to pass on the greetings of Valérie Pécresse, the president of the Paris Region Authority Council. You know how she is personally devoted to and attached to this sphere of higher education research, knowing that the Paris region accounts for 40% of French research activities. Whatever the indicator you look at, the number of academics and researchers, the spending amount and value in terms of research activities, be it public research and private research activities. And with respect to life sciences and healthcare, this industry accounts for more than 320,000 jobs in the Paris region. This is quite significant, as it is a defining factor for lots of economic sectors, and we are fortunate enough to have the first largest European university dedicated to health and healthcare, with Paris University and Paris-Saclay ranking among the first in the Shanghai classification. This is why we have recently amplified support to the research pathways in the Paris Regional Authority. Out of the 13 domains of focus, 4 had been devoted to health and healthcare, and Minister Olivier Véran spoke about gene therapy, about the One Health initiative, to mention just these 2 examples. So we'll keep supporting these research programs for the Paris region, for France at large, and for Europe at large. And we have a number of calls for projects underway as I speak. And I guess that the health and healthcare research activities and pathways will be very much promoted in the areas we promote and we fund. Some 40 million euros have been devoted to funding these areas in the Paris region regional authority, and will keep promoting research in health, healthcare, and life sciences. So obviously, we are still under pressure and the restraints of the COVID-19 pandemic crisis, and especially with students. We worked with many universities, with education institutions to support students. We'll be maintaining all these mechanisms and support instruments because the situations of students remain an area of concern. We've provided psychological support to support students in the Paris region. It will be continued. We have a number of initiatives and measures we've taken to support universities to screen and detect COVID cases, to vaccinate students. We have a support mechanism with 2 hotels providing housing to poor students or students in a situation of impoverishment, in addition to food aid and nursing care, which we provide to students with stipends and financial assistance, which has been provided as support for students and student support teams. There will be a contract to be signed shortly with the French government, which will include large budget sections for the higher education research. It's a €1 billion contract with the share of funding by the regional authority increasing. These are very defining investments, including a new research venue which will be built next to the Paris North University Hospital. There's the so-called Passerelle project or Gateway project for the Saclay University. The Kremlin-Bicêtre Medical University will be renovated as well, so which will channel lots of funding because we need to keep massively investing next to you to support research, to support our higher education and scientific educations and equipment will be eligible for these funding projects, which is of great importance, in addition to the so-called Sésame instrument, which is a program which channels both private and public funding. So I will not mention about my former role as an official in charge of European affairs, but I want to say a few words about this mobility of PhD students, mobility of academics and researchers and professors and faculty is of great importance, and we have budgets dedicated to these mobility mechanisms because we want to have a European health policy which is very active, and this includes transfer of technology issues. I decided I didn't want to be too long. I want to thank you all for the hard work which everyone is putting in, and with the president of the regional authority, Valérie Pécresse, we are here to help you to serve the residents of the Paris region, of France at large, and of Europe at large, and the world over. Thank you very much. Thank you very much, Otam Nasrou. It is now time, in just a few minutes and in 2 stages, I guess, start delving into the introductory part for Patrice Diot and Manuel Tunon de Lara with their introductory remarks, knowing that we're streaming live with the European Member of Parliament, Véronique Trilly-Lenoir. Then we'll have a discussion with her, and then we'll have Manuel Tunon de Lara with his introductory remarks. Thank you very much. A few words on this symposium. I would like again to thank all those who helped organize this symposium. This was a European effort and European contribution, and we've worked on the European level with respect to the 2 topics we'll be addressing, training, education, and research. The idea is that all together we feed into the policy developments for training, education, research in the sphere and field of health. So I will look at training education via well-being and health and comfort for students. We know that medical students have their own indicators with which identify deterioration of well-being, like suicidal thoughts, deterioration of health, mental health, psychological and physical health. And medical students have indicators in this respect which are worse than other categories of students. And this phenomena amplified due to the COVID crisis, due to greater isolation which was imposed on youth, and probably youth suffered most and more than the other categories of the population, and also due to their financial situation. So this deterioration of student life and well-being has several causes. Number one, compliance with and respect of regulations. In France, you know that all authorities, including all university conferences and all players, signed an action plan for preventing psychological and social risk with students. This was signed between students, organizations, and university conferences. But we need to go further than this. These concerns and these issues can be seen in all European member states, and there's a need for confronting our experience. The methodology for European university collaboration, which was mentioned this morning under several aspects, this has to be strengthened so that universities can be real sources and forces of proposals to build up this European health policy. It is important that European universities can get closer to and work closer with the European Commission to channel new funding towards enhancing mobility across university spheres. Also, local governments and authorities have their full role to play. The vice president of the Paris Region Authority said what role they played, and there are European funding programs which can be accessed by building upon the experience of their players around Europe. So all these topics and aspects will be looked at and addressed during our symposium, and hopefully this will make it possible to develop a common platform. Manuel, over to you to expand on what I've just said. So we'll be live, as I said, with European MP. Slight change in the agenda, but nothing major really upending our meeting. We are live with Véronique Trier-Lenoir. Madame Trier-Lenoir, you are a European Member of Parliament. Thank you for being with us. You are in Brussels or in Strasbourg, right?
Bonjour à toutes et à tous.
Hello, everyone. Good morning, everyone. I'm greeting all of you from academia. I'm greeting all of you members of parliament, and I'm speaking to you from Brussels. Now, there is feedback, technical feedback, echo and resonance in the audio connection, which is not so nice to hear. So we know you. You are a cancer specialist. You are professor in cancerology in Lyon. You're also a European Member of Parliament, and in your capacity as a rapporteur and spokesperson of the European Cancer Plan, and which is your line of specialty, but you also are the spokesperson of a commission on severe cross-border threats for health. So jointly with Olivier Véran and Frédéric Vidal, we heard these two ministers speak about the crisis that France and Europe and the world has weathered. What are the takeaway messages from this crisis for Europe, for the entire world, focusing on the strengths and the weaknesses? What were your takeaway messages as a European Member of Parliament and as a doctor, as a medical specialist? First, let me say that what French Minister of Health, Olivier Véran, told us about, summarizes in a nutshell what has happened. To say it in as simple words as possible, the initial muddling through the crisis and the trial and error moving forward by muddling through the crisis in the first stage was continued in the second step by a great grouping together and by a great teaming up to tackle the issue, showing very well that when we work as a group, we are more effective, we are more efficient, and we need to now strengthen this mechanism of grouping together so that we are better equipped, we are better prepared for the future to confront future crises. Let me say that the audio connection is very poor on my end, and I hope you can hear me very well. We can hear you very well, Madam European Member of Parliament, Madam Véronique Tillier-Lenoir. We are delighted to have you. I was struck by the fact that Olivier Véran and Frédéric Vidal told us that health and healthcare had special relevance and meaning for Europe. We hear that Europe and the European Union will be helpful for health practices, but it goes both ways, right? Before we look into this aspect, I would like to say, says Véronique Tillier-Lenoir, that with respect to the European health policy, there are several aspects that we need to look into. One of the first aspects is to get prepared for future health crises, and then another part is to continually focus on health as part of all European programs and policies, especially with respect to the Green Deal, quote unquote, which in itself has a raft of environmental measures with a comprehensive plan for prevention in public health. And I want to add to what Olivier Véran said with respect to fighting inequalities, gaps and differences in accessing health and healthcare in Europe are considerable, with 25% of life expectancy with respect and survival with respect to cases of cancer. 74% of European citizens want to have a European Union with enhanced skills and powers with respect to health and healthcare. And health and healthcare have become truly strategic stakes and issues, and the dependency we suffer from countries like India and China with respect to health and healthcare have to be stopped at the European level. It doesn't seem to be so dire and so terrible that there would not be a French vaccine, quote unquote. It doesn't seem so dire and terrible that French research does not contribute more to a European dynamic and momentum, which would make it possible to have greater control on our health policies without being dependent on China and India. And this is the goal and purpose of the European research area, the ERA, which Olivier Véran mentioned, and I would like to expand on. And you will tell us more about ERA, which is of great interest, knowing that in every member state we have goals and ambitions and also connections across agencies. I wanted also you to tell us, as you've just broached on it, that you give us some clarification on what the Commission on Severe Cross-Border Threats is about. What is the Commission about, and what is its powers? I didn't want to go into technical aspects, but again, you've mentioned this Commission twice, but it's not a Commission, it's a report. It's a legislative report which will be cascaded through the various European member states, and it provides for every European member state to be capable of implementing a mechanism and system to resist crisis, to get prepared, and to prepare its various authorities and institutions, including clinics, hospitals, and all health-related systems. It provides for the strengthening of health and sanitary bodies, including the Center for Disease Prevention and the Centers of Medication, which really and truly lacked funding and financial capabilities so that they couldn't play their full role to drive cooperation across countries. It is a mechanism and system which calls for international solidarity. And when you are confronted with a viral or antibiotic resistance or a chemical or environmental crisis, calls for European-level action in close connection with WHO so that what cannot be stopped at the borders can be addressed both at the level of the Schengen area and at the international level. The French President of the Republic in Lyon last Monday set up a World Health Organization Academy, quote unquote, which is aimed at offering all types of training and education, including lifelong training and basic training and education as part of an international mechanism which will make it possible for training and educating health professionals at large the world over to get prepared to crisis. And also with respect to medications, drugs and medicines, this regulation on severe cross-border threats will need to make sure that joint and common procurement and purchasing be the subject of a wider collaboration, that member states adhere to it, that the ERA agency, which will be directly reporting to this regulation, will be capable of identifying future crises, to stimulate research and development, to deliver the appropriate products, to stimulate production and manufacturing on European ground, along the same lines as Commissioner Breton started to doing, which will need to be more formalized, and also to fight shortages of medicines and drugs and medication. All this in line with and in the spirit of fighting inequalities in access to health and healthcare from one country to the next in the European Union, and obviously across wealthy and not so wealthy countries the world over. And Olivier Véran recalled that Europe was the largest provider of vaccines for the poorest countries. Let us keep going in this direction, both because we owe it to the other countries on a humanistic level, but also because for scientific reasons it makes sense to organize global health at the level of Europe.
Is it going to be as important as the US BARDA agency? Well, it is the model that inspires us. In terms of financing, probably not, but in terms of strategic importance and interest for the community, the research community, including health industry and for patients and citizens, it will be an absolutely essential tool for coordination, sovereignty and solidarity.
Que l'OMS soit à Lyon, ce sera ma dernière question.
J'ai pas compris le début.
Est-ce que c'est contente? Est-ce que vous avez été contente?
Were you happy?
L'Académie de l'OMS soit à Lyon.
The WHO Academy was held in Lyon. Well, of course, and that strengthened me, that comforted me in the belief that Lyon, second largest city in France, plays a decisive part in research and innovation, and and can contribute to the effort supported by the French president. We were delighted to have you. Do you want to add anything, Ms. Trier-Lenoir, before we pass the baton to all the other speakers? It will be our first panel discussion. Just a quick word. Within the EU, European health policy has to be a social policy. It's about minimum wages and fighting poverty, but more specific to health. It is about occupational medicine and health at work. And we have to tackle at the moment essential issues such as protecting workers against asbestos and carcinogenic compounds.
Nous ne parlerons pas que de ça dans cette
Well,
de concert, donc si vous nous suivez, vous serez
we will, of course, refer to this later on, and I hope you can follow our panel discussion. Many thanks and have a great day. Thank you.
Voilà, je vais passer la parole, le micro.
I'm going to give the floor now to Professor
Table ronde sur recherche. Merci.
Tunon de Lara, who's going to introduce the next panel discussion. Thank you very much. I listened with great attention our ministers and what the Madam MEP has just said.
Il faut le dire peut-être dans cet amphithéâtre.
And I think maybe it has to be said in this historic lecture hall, there is a paradox. Because on the one hand,
la crise a peut-être accéléré.
The crisis may have sped up, and of course it was wonderful ambitions and cooperation. We've just mentioned how it's helped move forward in terms of research and innovation in Europe. But having said that, that crisis went together with a crisis of science. Maybe it revealed that crisis. And beyond that crisis in science, you mentioned inequalities. Well, it's revealed many divides in Europe and also elsewhere in the world. Let's look at Brazil, the crisis and the reaction of some people. It shows that people can die from a disease because of political decisions, partisanship, and health has become a political and partisan topic. So recently there have been criticisms and attacks against the scientific community and academia. We've tried to defend researchers, which brings us back to the darkest hours of history. And yet again, I think it's apt for me to mention this in this prestigious lecture hall here at the Sorbonne. We know that science is about controversy, is about debate. But this constant debate and discussion and exchange of views has nothing to do with this fairly vain controversy I just mentioned. So beyond the investment in terms of financing human resources in Europe and in our own country, it raises the question, how can we reverse that trend? Because otherwise all our efforts will be for nothing. I think the answer can be found in research and education. A lot of effort has been put in, financial efforts in France and in Europe, and the organization of that agency is a great step forward. We don't need just any type of research. We need research to be independent, ethical,
Forme à l'esprit critique,
that trains critical thinking, trains into critical thinking. This is the role of universities in France, in Europe, and everywhere in the world. And I think what's also at stake here is democracy. Sometimes in the field of health, and I am a researcher and lecturer in health policy, so maybe we thought we would be spared because of the specificity of our field and how close we are to teaching hospital patients. But this question is now raised. It's about what we're going to look for in our approach, which has to be made of ethics, integrity, and a high degree of independence. And I think this is the path for Europe to follow. Look for a consensus across countries, and I think this is very fitting, a very fitting reaction and response as France is about to hold the EU presidency. Former speakers talked about the youth and 2022 being the year of youth. I think it's very important that we make sure that young people can identify with that approach in research. Thank you very much.
Merci beaucoup, Patrice Dio et
Thank you very much, Patrice Dio and Manuel Tunon de Lara, to open this first session, Research and Innovation at Work, to build a European health policy. Let me call...
Axel, vous êtes en ligne de Berlin. Est-ce que vous êtes avec nous?
Axel Priess, you're live from Berlin. Can you hear us?
Alors, le doyen de la faculté de médecine de la Charité à
So the dean of the medical faculty in La Charité in Berlin will join us shortly, but the French president will chair this panel discussion, and you will introduce the other speakers.
Dominique Alva. Dominique, je vous laisse le faire. Hein?
I'll let you introduce the speakers.
Bien, bonjour à tous.
Yes.
C'est un honneur de
Good morning. It is an honor for me to co-chair this panel discussion. I'm Gaël Grimandi, and so this panel discussion is about research and innovation for the building of a European health policy. I'm going to call Laurent Chambaud, who is the director of the School for Higher Education in Health Professions. I'll also greet Domenico Alvaro from La Sapienza in Rome. Are you with us, Mr. Alvaro? Jean-Yves Blais, who's the president of Unicancer and former president of the EORTC.
Christian Boitard
is a member, full member of the Academy of Medicine.
Voilà, nous saluons Monsieur Alvaro.
So we greet Mr. Alvaro, who is live from La Sapienza in Rome. Hello, sir.
Voilà. Alors,
hello.
Claire Giry.
Claire Giry, directrice générale de la...
Claire Giry is a Director General for Research and Innovation.
Martin Hirsch,
Martin Hirsch,
de l'assistance
Director General of Assistance Publique Hôpitaux de Paris, so the Paris public-funded hospital network. Thomas Lombe, who's the Deputy Director General for Strategy at INSERM.
Norsted, directrice responsable.
Irene Norsted, who's the Director in charge of
Madame Norsted,
Health.
avec nous.
Ms. Norsted, can you hear us?
Vous allez nous rejoindre dans quelques...
She
I can
is...
hear you.
Thanks.
Yes, I can hear you.
Okay, thanks. Et
At DG Research and Innovation for the European Commission, Axel Priess, who's probably joined us or will do shortly, is the Dean of the Faculty of Medicine in La Charité in Berlin. We're making sure the connection is robust. We're still missing Didier Samuel, who's the Dean of the Medical Faculty in Paris-Saclay, and Yazdan Pana, who's the Director of the ANRS, the National Agency for Scientific Research.
Est-ce qu'on est connecté? Alors, donc je vais tout de suite donner la parole
I'm now going to give the floor
à ce moment-là.
est-ce que John Middleton est en ligne?
Is John Middleton online? Can you hear us, sir?
Yes, indeed. Hello. Hello. Bonjour.
Monsieur Middleton est en ligne?
Oui.
Ah, voilà. Je crois que Monsieur Middleton est en ligne avec nous.
Yes, I think Mr. Middleton is with us. So I'll start by giving the floor to Professor John Middleton. He is the president of the Association of Schools of Public Health in the European region. So I give you the floor, and I thank you very much for joining us.
Merci. Bonjour, chers amis, collègues.
Hello, dear friends and colleagues.
Messieurs et mesdames.
Ladies and gentlemen.
C'est pour moi un grand honneur.
It's a great honor for me and a great pleasure
aujourd'hui pour
to take part in this conference.
Pourquoi est-ce que je l'appelle le meilleur travail du monde?
Why do I call it the best job in the world?
J'espère
to work for people's health, and I hope I can succeed in contributing some ideas that can help make headway for health, better protect the health of people.
Je suis très triste de ne pas pouvoir rendre justice à votre belle langue.
I'm very sad that I cannot do justice to your beautiful language.
Et prononcer mon discours en français.
And give you the whole presentation in French.
Mais alors, certaines personnes me disent que je ne parle pas très bien anglais.
Some people say I don't speak English very well either.
Okay. Can I have my slides, please, Olivier? What is public health? Sorry, my slideshow is somewhere in the middle at the moment. Let me see if I can get back. So, what is public health? Public health has been defined by WHO as the science and art of promoting health, protecting protecting health, promoting health, and prolonging life through the organised efforts of society. And that's very important, that it is the organised efforts of society, not just the organised efforts of doctors, health services, but the organised efforts of society. And we describe in the UK's Public Health Good Practice document, we describe public health as an activity in which there is it's an activity which is based on population health. It's a collective responsibility. There's a key role for the state, and there's a key role for partnership working. And I describe two notions of public health. One is the idea of the health of the public, and the health of the public is everybody's business. It requires politicians, local people. It requires the involvement and the active trust of communities and the people we serve. And there is also, though, the public health system, the service, and the profession. And without that dedicated specialism of public health, there is no population health insight. There is no means by which we can improve the collective health of our communities. So if we look at the public health system, first of all, we describe three domains of public health in the UK. Health protection, which is everything that you imagine around the pandemic, around infection control, preparedness and control of threats to health. Health improvement is about healthy public policy. It's about health promotion, health improvement, and a very major area in which we operate. And then more so in the UK, but I'm reminded of the Charcot and the therapeutic nihilists, the application of public health, the application of epidemiology to clinical practice, the assessment of the quality and the effectiveness of clinical care. We also describe in the domains of good practice the need for knowledge, skills, and performance. And there are a set of competencies around public health that need to be developed and need to be enhanced and have been brought into sharp light by the pandemic. Safety and quality is clearly something that we need to be concerned about. Communication, partnership and teamwork, and maintaining public trust. And that is the big one, where the idea of a profession is not a threat to the public, it's for the protection of the public. And we need to ensure there are professional codes of conduct that demonstrate this. My organisation, ASFA, has produced a number of documents on competence, the one we jointly with the WHO, and also that one covers the competence of a public health workforce and systems. There is also the fifth core competence book, which describes the competence, the curriculum really that needs to be taught in our schools, particularly at master's level. Now, the European Medical Specialists Union describes public health as a medical specialty. And certainly I agree that we need a strong medical component to public health. But to call it a medical specialty is perhaps to miss the main essence of public health, which it is a multidisciplinary profession, a multidisciplinary service, and a multidisciplinary venture. And if we go on to some examples, some British examples, some Victorian examples, Edwin Chadwick was a lawyer, wrote the report of the Poor Commission in 1848. Joseph Bazalgette was an engineer, built the sewers that protected health in London. And Florence Nightingale and Mary Seacole were nurses who played an important part in establishing methods of infection control and studying hospital statistics. And John Snow, of course, was the discoverer of the root cause of cholera in an outbreak, a major outbreak in London. And of course, on this side of the channel, Louis Pasteur was a chemist. So we need our multidisciplinary approach to public health. And that, I think, has never been more obvious than in the 21st century. And the One Health umbrella describes these multiple interventions that we need from veterinarians, from economists, from environmental scientists, climate scientists, a whole raft of people who have to be involved, not least of which now is international law as we seek to find a vaccine waiver, a TRIPS waiver for vaccines. So the public health is a very general and very big activity. Sir John Simon, the first medical officer in London and the first chief medical officer for the UK, described health as being the interests of health and the interests of common physical comfort and convenience were in various cases identical. And this tradition has moved through to the modern times of the idea of health determinants, the quality of our housing, the water, sanitation, good food, satisfying work, freedom from violence. These are all major determinants and major things we have to protect to keep our health in place. Rudolf Virchow, a major player in public health, in politics and in medical science, described medicine as a social science, and politics was nothing more than medicine on a large scale. Well, I said something slightly more simply in my first annual public health report. It's not who your doctor is, it's who you vote for that most affects your health. And we've seen that in big measure with the current pandemic. So let's have a look at a few of the challenges that we face. Health is global. This is the table diagram for causes of death in France from the Institute of Health Metrics and Evaluation. And that big blue box is deaths from non-communicable disease. The red box at the top is infectious causes, and the green box is violence and accidents. And that picture is shared across the world now, in rich or poor countries. Non-communicable disease is the biggest cause of death. Now, if you think that this is an illustration of where the major causes of death are, and the ones that are ringed are the causes that are food related. And in this estimate from Simon Capewell and others, 40% of all deaths were attributable to all non-communicable disease deaths attributable to diet, including alcohol. Now, if you think about that 40% of the 70% of all deaths that are non-communicable disease, and think you can influence that or control it by individual health promotion, you should think again, perhaps. Here is an illustration of the 10 major companies that control most of the food we eat. These companies require regulation, taxation, control of their marketing, control of their advertising, if we are to achieve better health for all. And this is a major challenge for the public health community and indeed political leaders and the community in general. Climate change, the biggest threat to the health in the 21st century, according to the Lancet. And they went on to describe in their Planetary Health Commission major impacts on from climate change, but also from multiple factors that were influencing the health of the planet. We're losing soil, we're losing forests, we're losing marine life. All of these impacts are combining to create a major threat to the health of people, to the health of planet and of animals as well. And if you don't think climate change, if you think climate change is for the future, it's already with us in the form of forest fires, in the form of floods, and indeed in this example from Alaskan fish stocks being so depleted that the fishery had to be closed last year. Most floridly, of course, the pandemic demonstrates how the interaction between animal and human, brought about by deforestation, brought about by the plunder of bushmeat perhaps, is a factor in this pandemic, but will also be a factor in future pandemics. And then there's the role of violence. Violence is a major public health problem, and conflict resolution needs to be on our agenda as something which requires a public health approach. Infodemics, most rapidly observed in the public health community in the misinformation about vaccines, but we've seen it in so many areas where unqualified and fanciful commentators make pronouncements in the press which kill people, and as the chair said earlier, our politicians have done the same as well. Populist politics will get you killed in this pandemic. So moving on, this is the current state of the pandemic as we approach 5 million deaths. Europe has borne more than its a heavy burden, and none of us have come out with any great distinction for our efforts in this, but principally around, as I will say, the erosion of public health that took place in the many years leading up to this pandemic. In the UK, years of austerity created a population that was already vulnerable to the pandemic, but that was also compounded by the erosion of services. And we've also seen that on a European basis, and this was our call in the EFA journal to improve investment in public health services in the future. Our leaders earlier this year, and supported very much at the front with President Macron, called for action for a public health, a pandemic preparedness treaty, and that call is something that my sister organisations on 5 continents also support. We've seen it we've seen efforts in the European Union. The European Health Union is very much focused on preparedness and prevention and surveillance, regulation of the pharmaceutical industry, and at the same time the European Health Union manifesto, being led by the European Health Forum Gastein, calls for a much wider approach to public health in the future from the European Union, addressing health in all policies, addressing inequalities, addressing environmental degradation and protection, and climate change issues. And there is that manifesto. Moving on then, building back. A lot of aspirations for building back, but do we want to build back to a world of austerity, poverty, unfairness, unequal use of resources, environmental squalor? I say we should plan for an outbreak of health. And it's echoing a call from William Beveridge in the depths of World War II when they planned for a welfare state for the UK. He said we should regard want, idleness, ignorance, squalor and disease as enemies of us all, and we should refuse to make our separate peace with evil. Now, that theme is echoed now in the calls for vaccine justice, very much with President Macron at the forefront. ASFA called in January for a fair and equitable distribution of vaccines, not just for the protection of people in low-income countries, but for the more rapid exit from the pandemic than we are otherwise going to achieve. And I think it's important to finish on this word from Louis Pasteur: science knows no country because knowledge belongs to humanity, and it is this torch which illuminates the world. I thank you for allowing me to make this presentation to you, and wish you every success in your deliberations, and offer the support of ASFA and all its members to help you in the future. Thank you. Merci.
Thank you for this very interesting communication. J'appelle le professeur.
I would like to call Professor Axel Priess, the Dean of the Berlin Charity Institutions. So he'll be doing his introductory remarks as well as his presentation. You have the floor, sir. We cannot hear you, sir. It seems there are technical issues with respect to the audio connection.
Is it better now? Can you hear me?
C'est bon, nous vous entendons.
Yes, we can hear you, sir.
Le plaisir du direct, mais c'est fait.
Monsieur Axel Priess.
Sorry, sir, we cannot hear you.
Vous n'avez peut-être.
But now it's better now.
Voilà, très bien, very good.
Voilà. Excusez-moi. Yes, it's a very relevant issue to look at the impact training, research, and innovation can have for public health, as it was just alluded so brilliantly by John. And we need to train the future generations to look more intensively at the different angles of public health and health in Europe in particular. And as it was said, our forefathers, including Virchow and Pasteur and others, have had a very clear vision on what is needed to provide health for many people. And therefore, in our medical education, we have to switch clearly from looking into very many details of molecular or physiological aspects and include in our curricula other aspects which will be the fundamental for the provision of health in the upcoming future. And so one arm we should focus on is broaden the education from over specialization to a broader look into relevant items for health. And the other aspect for the European society, but also for the European countries and the European bodies is research. there is a lot of research done via the European mechanisms, but this is in very many aspects fragmented and not extremely effective, with some very brilliant exceptions, like, for instance, the ERC grants. And if you look at the funding, it has to focus on long-term issues which are relevant for health. And as John, for instance, just showed, high blood pressure is one of the most deadly conditions. And I still remember that in the framework 7, I think, there was a focus on tackling high blood pressure, but it was considered by the EU mechanisms that during one framework this problem would be solved. And this is not true. We know from medicine that problems usually are not solved very fast. So we need a different scheme of both of our teaching and the research funding. And the research funding must build on the synergy between our nations, which have a very rich culture in research, but it's not brought together very, very effectively, let's say, between France and Germany. And the funding has to be simple and it has to be sustainable to allow a long breath on things which are fashionable in 1 year and less fashionable in another year. 3 years ago, funding on vaccine development or funding on virus infections was not extremely mainstream, but now everyone thinks that's exactly what we need. And science needs a long breath, a long vision with respect to what people need in the end to have a healthy life. Thank you very much.
Thank you very much. I will give the floor to our two moderators who will be handling the various speakers and the questions from the audience. And we also have our two spokespersons, including Ariane Berdal, one of our moderators, who will be reporting back at some point. Thank you very much. What I suggest, knowing that we have a bit less than 1.5 hours to conduct this panel session, what we decided with Reza is to have each speaker focus on one specific item with some 5 minutes for their developments. I just want to go back to what John Middleton said in his introduction. Two very quick points. He very clearly demonstrated that health and healthcare were everyone's business, and we had to take this into consideration, and especially that officials and policymakers and decision makers had to take this into consideration. And the second point is that these issues and items had to be looked at and addressed in as multidisciplinary way as possible. I suggest we take the first point and we give the floor to Domenico Alvaro, if we are able to do so by technology. Are you with us, Domenico Alvaro? Yes, we are.
Okay. Thank you, dear chairs and coordinators. It's an honor for me from my university, Sapienza, to participate in this important symposium. Now, it is clear, without any doubt, that the pandemic has highlighted the weakness of our health systems, the suffer of the absence of the home assistance, the scarcity of the territorial services, and the lack of a real integration between territorial services and between these and hospitals. Most likely, many patients affected by COVID-19 could have been cured at their homes, avoiding hospitalization and the spread of the pandemic. These patients could have been monitored remotely and admitted to the hospital only for severe cases, as well as the tracing of the infected subjects in the territory could have been allowed to implement strategies to contain the spread of the virus. In substance, the pandemic highlighted the importance of networking home territorial services and hospital in emergency management. The Mission 6 of the Italian Recovery and Resilience Plan, endorsed by the European Commission, aware of the centrality of the territory, returns with vigor to the theme by providing for the creation of new intermediate care facilities called community health house and community hospitals. These facilities must be tightly connected with the home of the patients, all with one health perspective based on the design and implementation of policies, programs, legislation, and research with a multidisciplinary and multi-professional approach. Let me spend a few words point by point on this model that I wish to propose. First, home care as first point of assistance. Our goal is to increase the number of people treated at home care to 10% of the population over 65 through investment in hardware and increased service provision. This implies expanding remote doctor-patient interactions, including interaction with territorial services, for diagnostic and monitoring as the basis for the success of home care. Second, community health houses, managed by a multidisciplinary team of general practitioners, pediatrician of choice, specialist doctors, community nurses. This represents a continual reference point for the population, also through an IT infrastructure, a blood sampling point, multi-specialized instrumentations, in order to guarantee the taking charge of the patient residing in the reference community. Third, community hospitals, for patients who required medium low-intensity health interventions and for short-term hospitalization. This should be constituted by 20-40 beds with mainly nursing management, such as to contribute to greater appropriateness of care and lead to a substantial reduction in improper access to the hospital. Home care, community health houses, and community hospital are coordinated by the territorial coordination centers with the intent to link and coordinate various territorial, social health, and hospital services, as well as the emergency urgency network. They ensure the remote control of the device provided to patients, support the exchange of information between health professionals, and constitute a reference point for caregivers and patients' needs. This model I wish to propose as a shareable health policy with common rules and regulation within the European Union aims to reduce the use of hospitalization or relocation to urban areas and to bring health care closer to the citizen, facilitating access also thanks to digital health technologies. The specific objectives or inspiring principles of our proposal are home care as first point of assistance, networking home territorial services and hospital, expanding remote doctor-patient interaction for diagnostic and monitoring, platform for screening telemedicine projects and for epidemiology, electronic medical record linked to platform for a centralized data connection analysis, expand research initiative on digital health and care technologies, expand information on digital health, and finally, data sharing. This model should work also in normal times by improving the research and innovation in digital medicine, but also by a specific information stakeholders where university must have great responsibility. In fact, at national level, an attempt is underway to provide at all levels, high school, university, specialization, and general practitioners with certified training credit focused on digital health. This is a complex and ambitious project where a European governance of surveillance technologies is needed, with the recommendation for security policies in line with ethics and fundamental rights, including privacy, security, and circulation security. Thank you for your attention.
Thank you very much, Dominique Alvaro. Donc, je vais passer la parole à Jean-Yves Blay.
I will now give the floor to Jean-Yves Blay for his preliminary remarks. Thank you very much for your invite. I believe that at a time when France is on the verge of taking the presidency of the European Union, within the next 5 minutes, I wanted to address the issue of clinical research and transfer research, and in the field of my own discipline, cancerology, generally speaking, in the medical sciences, there are disruptive changes. We all know that precision medicine has gained traction in the field of oncology. It has had a number of consequences above and beyond the engagement of forces which were not traditionally involved in providing routine care for patients. It has generated a closer cooperation and confrontation with and between transfer and basic researchers, and this fragmentation of the management frameworks we've had in the various medical disciplines using precision medicine has generated greater fragmentation of disease treatment to take up what Paul Vary said, what is simple is wrong, and we need to make this new type of knowledge usable at the European level. And Europe was extremely important in clinical research and transfer research in the field of precision medicine via the various European projects and programs that I participated in or that I headed up. Very permanently and constantly, the European Union has been accelerating the growth in careers for young researchers and young academics, and this has encouraged participation, and we shouldn't ease up on this participation at a time when France will become will take up the presidency of the European Union. As a point of illustration, I want to mention 3 examples which are, according to me, sources of information going forward for the future, also pointing the way towards the future directions. It was my privilege to chair a European clinical organization which was called ORTC, which across the board has defined the standards for treating patients with cancer, where some covering some 50% of the decisions doctors were making. So it was a European jewel, really, which was created by 3 doctors, including 1 French, 1 Italian, and 1 Belgian doctor, which 60 years down the road still has great credibility and independence in clinical production and scientific production. Very remarkable and quite astonishing. These organizations, which are European jewels, are not directly supported by the European Union, which is more focused on supporting projects. Such institutions and bodies should be supported, which are defining bodies in which very many young academics and researchers worked in these bodies, got inspiration and knowledge, and went back to their own respective countries to continue their work. So it's no longer an option to move to other countries to learn and get educated, as the fragmentation of the nosological frameworks is a given, and we need to work with others, and it's a good thing. The third example I want to mention is that of the ERN networks, which France has been leading the way in rare diseases and rare cancer cases. These networks have been very effective and given great results. ERNs have been in existence for a bit more than 3 years in the European sphere. And for the one I'm heading up, it groups together more than 100 leading institutions covering more than 26 countries. These again are European jewels and have been improving the way patients have been treated have demonstrated the way care has been improved and the survival rate has been improved as well, thanks to the ERN networks. After the cancer mission in the Beating Cancer Plan, it is important that these networks, organizations, and institutions get as much support as they can, as it is a way to fight disparity and inequalities across countries. And I can but know that support and assistance given to the ERNs are less important in volume terms compared with the support and assistance given to rare cancer and rare disease bodies in our countries. The third and last point, France played a leading role in a number of programs and initiatives in clinical research and cancer research at the European level, and could lead the way as it was driven by momentum, dynamism, and agility. Having said that, the current situation is probably slightly different. Academic and transfer research has somewhat lagged behind for a number of reasons which were identified, and it is our collective responsibility to come up with solutions to re-accelerate. We can't engage in this type of race lagging behind. Our European colleagues have been excellent, but in a way they are competitors as well. So it is up to us in this European construction to restore our ability to engage in the race, and this French dynamism and agility, which we proved previously in past years, we need to revive and restore very quickly, and I have great confidence that we can do that. So much for what I wanted to tell you with respect to oncology and the centers of reference, which are those institutions being grouped together in the ERN networks, are good examples of what medical research and transfer research in Europe can be, using centers of reference working as a network. Thank you very much. Thank you, sir, for this communication. Over to Christian Boitin, a member of the French Medical Academy. Would you like, Christian, to expand on what we've heard? Well, thank you. I think that we're all convinced, and I am in fact convinced, that there's a need for European research which is strong. In order to have a strong and robust European research, history has it that France has its key role to play. My first message is that there's a need in France at the national level to have a stronger, closer coordination, a closer connection with the European levels in order to play our full role. This could be a negative negative insight, but we all believe in European research, and we need to get better coordinated in order to connect with and contribute to this level of European research. My second message is that in France we have a very interesting program, which is Active Avenir program, and I'm heading up this program for the INSERM body, and it is also being jointly led by CNRS. This program played a role in the emerging frameworks in Europe, because the CNRS ATIP program was a precursor to the ERC program, and the future INSERM program. The Avenir program by INSERM also played a key role. Why am I speaking about these two programs? The first is that some 30 to 40% of young researchers and academics which have been recruited in the ATIC Avenir program, who are non-French and very often European researchers and academics. And these are people who will move and travel across European countries, which will make it possible to generate this mixing and mingling, contributing to European level research. Now, what has made the ATIP Avenir program successful in France is very probably the way it has been recruiting scientists and researchers and academics into French labs. And this recruiting involves committees or juries, very much like the ERC panels, which has European academics, researchers, and scientists on board of these panels. When you look at the INSERM programs, very many INSERM programs having a starting consolidator ERC very often go through this ATIP Avenir program. This ATIP Avenir program has set the example as to what research should be like, going from downstream, from upstream all the way to downstream, with continuity and continuum from basic research all the way to applied research. And it is part of this program, of the soul and genes of this program, very much like the ERC. Going back to Bourguignon, who shared these numbers with me a few months from now, the ERC in the previous program accounted for 17% of the money channeled by Europe into research, accounting for 27% of patents, versus the previous ERC program, which was not targeting the filing of patents and innovation. And by investing into basic research was the way to have a greater number of patents. Last point, I was quite sensitive to what a number of you said when you spoke about the non-communicable chronic diseases. Research in this field is of great importance. This is one of the challenges in biomedical research for the next 10 years. Why is that? Well, it basically highlights the need to fully understand the interactions between diversified genomes and the environment, which has changed tremendously. And this is a field in research of great importance. It is not a field of research which has gotten much support and assistance from France and the French government. There's starting to be a number of European-level programs in this respect, and I believe it is of great importance.
Thank you very much.
Donc, on va passer la parole donc à Claire
So we're now
Géry, qui est
going to give the
directrice
floor to
générale
Claire
de la
Géry.
recherche
She's
et de
the Director
l'innovation.
General for Research and Innovation.
Merci beaucoup.
Yes, thank you very much.
Alors, je vais avoir peut-être un regard un peu complémentaire par rapport à ce que vient de dire Professeur Ouattard, mais évidemment, dans mon rôle et en général...
My perspective will be a bit complementary to what has been said. I think the capacity to attract talents in research is absolutely essential in my line of work as well, but I'd like to focus more on health policies in Europe. How can we move forward? And also thanks to research and innovation. So, generally speaking, I really think that research can help in the assessment of public policies. That's something I really try to advocate for, and I think in health it is even more obvious than in other fields. So the question I would ask in another way is how can research contribute in the building of a European health policy, but also what do we expect from it? What does research need and expect so that we can move on to a European health policy in the fields where it is relevant? What can research contribute? Well, everything to do with the Horizon Europe program and ERC programs. I think the European research is a reality, and I'm sure Irene Nordstedt will say more about this. So what do we need to make more robust in terms of research on a European scale? There are two aspects. There are, so to come back to the graph about causes of mortality and the main pathologies that affect Europe are cancer, metabolic diseases, cardiovascular diseases. I'm looking at the distinguished speakers around me that are specialists specialized in this. So this is where we have a very robust and research network. We have excellent research teams in other fields as well, but that's not enough. We have to align our strategies. There's an effort to have joint programmation, and it takes time. That's what we can often reproach European programs for, is that it takes too much time. But
L'autre sujet, un petit peu à l'opposé.
And the other topic are rare diseases. On a European scale, we can do better because we can have more to analyze. It's a wider field for research, and the more we can accumulate data and patients, if I may say that, because in our respective countries, we do not have enough patients to make headway in research. So I think the European scale does contribute something that is absolutely essential on rare diseases. And I can widen this to health data. The more health data we have, of course, the more value it creates. And Martin, I'm sure, will say so. On a scale of a hospital, well, of course, depends on the size of the hospital, but we have data, but when we look at bigger scales, we can use also AI and make the most of the data. I don't know how much time I still have left, but what does research need? Well, the European scale, the European dimension in all its regulatory process needs to contribute to that. We'll always have limitations in Europe in terms of health if we do not work on regulation. I'm thinking of clinical trials and even health data. There's a lot that exists, but there's still a lot to be done. So we have needs so that we can be more efficient. And clinical trials during the crisis demonstrated that we need to have more aligned regulations, in particular in terms of clinical trials, but not only. And I'll stop here. Thank you very much. Yes, please pass on the mic, because we're now going to ask Martin Hirsch what is the most important message you want to get across. Well, thank you very much. I want to think I want to spare a thought for Yazdan, because whenever speakers speak in an alphabetical order, he always speaks last. Firstly, when I look at how Europe reacts to crisis, and when I compare that to what happened 20 years ago when I was involved in food security, and there was a major crisis in Europe on substances related to mad cow diseases and other dioxins. And the problem was the lack of strong measures that could call into question the European single market. And the priority was not at all to protect patients. In the COVID crisis, we need to remember that Europe is the continent that bought jointly and in a centralized manner vaccines so that we didn't have a vaccine war. I think this weakness of Europe in terms of health and research and innovation originates in a very European angle, which is to think that the first role of Europe is to organize the single market, make sure there's no competition bias, and to organize the enlargement. And faced with germs that circulate and worldwide disease and Europe-wide diseases, that approach is not only not enough, but it can be counterproductive. So, I think we've started to see a rebalancing effort, but that's there's need for more rebalancing, and we need to ensure that in what we entrust the European Union with, there has to be also the protection of patients, of users of hospitals, of the general public, and a real vision for health policy that we're going to entrust the European Union for. And even just saying this explicitly would have a certain number of repercussions.
Également le lien avec l'innovation.
If I draw the link with innovation,
dans les grands hôpitaux publics,
and the integration of innovation in big public hospitals, it depends on the capacity to acquire innovation.
Nos codes des marchés résultent de règles européennes de l'achat public.
The rules on the markets are an impediment to, and the rules of procurement are an impediment. So it's.
Deuxième idée, il m'a frappé il y a.
That may not be very visible, but it is important. 4 years ago,
le réseau des grands CHU européens.
I think we need to trigger a networking of major European flows. And of course, in the telecom sector and the yogurt manufacturers got organized a long time ago. But looking at hospitals, before 2017, not a single effort in that regard had been made. So there's a lack of connection between the European dimension and the teaching hospital network. Even though universities were more organized in networks, but there's a need, and there's currently a network of the 9 largest hospitals, Karolinska, La Charité, Paris, San Raffaello in Milan, and so on and so forth. And the reason, the rationale behind that network of the 9 largest hospitals is to rise to the challenges of in terms of health. And to wrap up, if we look at COVID crisis, what's really interesting in terms of public health, because when you look at the reactions of countries, the response, what was a key element was not necessarily the most advanced technology. What proved to be a key success factor was, are we in a country where health insurance makes it possible to take a test for free, and other modes of circulation of the virus are prevented because there's easy access to health prevention, and the fact that we were able to provide the population with face masks. If we look at organizational questions, but also questions of relations with the public opinion, make it possible to have a public health policy that can help us fight. And there are weak points that we need to rectify. In the European Union, we need to redouble our efforts in terms of research and innovation in Europe to revisit the big concepts of hygiene and public health. Even though Europe was where all of this was born, but all the interconnections between public health, research and innovation, and health systems, this is what we can work some more, so that all these dimensions can be put in under the spotlight more than they have been. Thank you very much. And I'm going to give the floor to Thomas Lombès, who's the Director General for Strategy, Deputy Director General for Strategy at INSERM.
Je suis très heureux d'être avec vous aujourd'hui. Je vais peut-être enlever le masque. Ah, voilà. Donc très heureux
I'm delighted to be here with you.
Éminemment important, c'est comment on construit.
I think what we're discussing here is absolutely important. Is how we can build a European health policy for us at the INSERM. It's absolutely essential. INSERM is involved in about 400 European projects. Our global budget is 730 million euros. So there is a lot at stake. to make it possible for all our partners to deliver on our project, but it's also about collaboration, networks, and organizing the scientific community so as to make our research more visible and so that it can contribute to also care pathways and protect the health of our fellow citizens.
L'Europe de la santé de demain.
I have maybe one big message, which is that to build the European health policy of the future, there's the continuum of research, from fundamental research up to the bed of the patient. And if we still work in silos, and if we study prevention separately from diagnosis, then we cannot be efficient. And what the crisis has demonstrated is to consolidate the passing of baton in our Team Europe and Team France, so that it can work better and break silos. INSERM, which is the National Institute of Health and Medical Research, plays a hybrid role with its hospital partners, but also as an agency for scientific steering and financing on a number of pathologies. We talked about cancer. We are going to talk about emerging infectious diseases as well. In these fields, we can see how we can make it so that communities from epidemiology, fundamental research, and others work together. And that is a lesson we've learned with this crisis. This continuum from fundamental research down to the bed of the patient is something we need to work in terms of design and the levers we can play upon in terms of financing of research and innovation. And I also think, and Christian Boita mentioned it, we have to work on this, on strengthening this continuum for professionals in research and care. And that starts with training. And we, through the INSERM Liliane Bittencourt School, we try to build bridges and gateways by training young professionals via research. We talked about the ATIP Avenir program. And the last point I wanted to touch upon is that this continuum, this research continuum, should be examined, saying that whenever in France we launch an initiative, we have to ask ourselves from day one how we can interconnect it with the rest of Europe and make it a more global initiative. And I want to give you two examples that seem quite symbolic. The transverse program that, or cross, the UDECA cross-cutting program for a cellular atlas of stem cells, and it has been successful in how it helped organize our French infrastructures, and then it moved into a Europe-wide program. The Minister, Olivier Véran, talked about European efforts on antibiotic resistance, and I think that we stand a good example in France because there's a number of plans in France, and we are involved in a priority program on antibiotic resistance at the INSERM, and we need to really work more on the interconnection with the joint action in Europe through the DG Health. So, the take-home message is to think this research continuum from the day one of the launch of our projects. This can be done through a constant effort on governance, and in Europe we mentioned a number of tools, missions, agencies, EU for Health, other dedicated tools and instruments. The catchword and the key word and our constant attention has to be cooperation and synergy, and make sure that there are no redundancy or competition between the different tools, and that is not easy to do. And the last point, and maybe to pick up on what Martin Hirsch was saying, independently from the institutional governance of our different institutions, a European Commission or a national institution. We need to work amongst stakeholders, hospital stakeholders, research stakeholders, patient associations. We need to work together to build on what we've learned from this crisis and engage in a constant dialogue so that we can speak with one voice and influence European planning and programs and help structure our sector. Thank you very much.
Merci. À ce stade, je voudrais juste.
Thank you very much. At this point, I would like to ask Axel Priest
to add something to your introductory speech.
Would you like to add anything to your introductory speech, sir?
Yeah, very much so. Thank you. Thank all of you very much for the very interesting remarks. And I think what we need are strong European bodies which push for a joint use of all the intelligence and all the different aspects we have in European countries. We heard from INSERM and we heard from other very strong bodies which can foster research. But I think what we have to learn in Europe, and the crisis did shed a very brutal light on it, we have to work together more closely across borders. We need to find mechanisms how we can use many brilliant research communities on the European level. And therefore, I would argue for something like a European Council for Health Research, which brings together all these different entities and let them work together for the benefit of European research and European population. Thank you very much.
Thank you very much. On va passer la parole à Didier Samuel, donc qui est doyen.
Thank you very much. We're now going to give the floor to Didier Samuel. He's the Dean of the Faculty of Medicine Paris-Saclay and also Chair of the CNCR.
Merci beaucoup.
Thank you very much.
Je vais me permettre, donc je représente
If I may, I represent the university hospitals here and also research in hospitals through my position and as chair of the CNCR. I think one of the important points, if we start from the beginning, to be respected on a European level, we need to have a strong research, and to be respected globally, we need to have a strong European research. What the crisis has taught us is that the role of university hospitals and teaching hospitals has been absolutely essential, but it's also highlighted our weaknesses. Our weaknesses are intrinsic to the institutions where we are, and also in France, clearly to lack of investment in research and health, which is beginning to be quite obvious. And post-COVID, the good news is that the planning law on research, even though it's not sufficient, is a good step forward, and the reorganization of the National Agency for Health that is going to focus on innovation in health. That is very important. I want also to say that it is absolutely essential to understand post-COVID, the post-COVID phase, the importance for clinicians to ally, to be allies with researchers and to open up to new professions in research. We have to open up to these to biostatisticians and many other new lines of work and directions that will be absolutely essential in research. and already are. About opening up to Europe, I'd like to say two things. First, I would differentiate the links that exist between learned societies across Europe. These are interpersonal links that are very strong, and they help develop research networks and joint publications that are often of an international level. I was at the head of a European journal on liver diseases for 5 years, which is my specialty. There were 25 associated editors, and I can tell you that for 5 years it was really that was really the Europe of research. And this is something that is very strong, that needs to be advocated for and defended. And then I would also say, talk about the more political organization of research. European research plans in France, and we have to admit to it, we were quite good at handling tendering processes and bidding processes, but we're not so good at opening access to European programs. And we'll see what happens with Horizon Europe, but we need to set up clusters to support this opening up to European plans, because our clinicians do not know how to tackle applying for these European programs, and sometimes it's a huge workload for clinicians who do not have much time to dedicate to it. And also the interconnection between these European programs that the Commission builds, that are well financed and very important, and also research through networks on rare diseases, ERNs, but also learned societies across Europe. I think these are too scattered and not connected enough. I am a great believer in the strength of our research, and I think it is absolutely necessary to invest more and to sanctuarize the time dedicated to research in teaching hospitals, and the opening up to Europe, that is absolutely fundamental as well.
Merci.
Thank you very much.
Well,
first I'd like to thank all the speakers, because you've actually stuck to your 5 minutes, which means that Yazdan Pana, even though he comes last because of the alphabetical order, still has 5 minutes. Yes, that's true, because quite often, I always come at the end, and at the end there's no time's up. So I want to insist on who I speak for. I am here as the coordinator of HIV/AIDS and emerging infectious disease network, but I'm also a clinician. I'm also someone from working at a hospital, and I'm linked to INSERM and to research coordination. I am a convinced and committed European. Ever since December 2019, we were the first European hospital. Maybe in Bordeaux they're going to be jealous because they came 2 hours later. They got their first cases 2 hours later. But we got the first cases, and from the first minute where we received these first patients, and even beforehand, we really tried to reflect on research on a European scale. As Didier Samuel said, bearing in mind that we will only really be present and get a foothold if French research is strong enough to exist on a European level. And we have to, something needs to be said explicitly, which is that nationalism has triumphed at some points in this health crisis. And there will be other pandemics, but there's not only pandemics, there's also an aging population and other challenges that we'll have to face in the future. And I thought I would use the example of what I've experienced, and in 3 minutes try to tell you about what I've seen Firstly,
l'Europe de l'innovation,
I think
c'est une force
the Europe of innovation is incredibly strong, and this crisis has demonstrated how Europe can be an incredible strength. With vaccine, it was clearly illustrated, but maybe on research we didn't have the same successes, even though we are very much building all of this, and we'll see that it bears fruit very shortly. I think innovation starts when we develop candidates, we help them, we train them, and the continuum, the research continuum that Thomas underlined is very important. So, I'll use the entry point that I saw, which was the assessment of clinical trials. Clinical research is absolutely essential. You know, there's there's a sort of slogan, next pandemic, we have to get a vaccine within 100 days. And clinical research is absolutely essential if we want to raise to this challenge. As Martin Hirsch said, we can assess very quickly because we have a lot of similarities on a regional scale. And what we saw, I don't think it was a problem of financing. I don't think it was a lack of financing or a lack of coordination. It's more to do with regulation. That's extremely important, regulation considerations. And I think Irene heard it because we wrote to her to tell her that. VHP harmonization programs have been thought up and devised to improve that. But I think it's not up to the Commission, it's up to Member States. Member States need to work together to improve this. Those are legal issues. We need to sign a contract with each hospital, and that is so time-consuming. It's even more time-consuming than regulation, and it's really practical stuff we're talking about. Financing, yes, but financing that are not on a 3 or 5 year period. If we want to set up a research platform to really make a difference in the long term, we need to work towards sustainability. So I don't know which system that could be to make sure that it's fair and ethical, but we need to work on sustainable systems. Programs and systems on a 3 year or 5 year basis are all very well, but they're not enough. I'll stop here, but I really think that this crisis has not seen the failure of Europe. It could prove to be the strength of Europe.
Thank you very much. So to wrap up this introductory session for the panel session, I will turn to Irene Norsted, Director and responsible for the Health Directorate at DG Research Innovation with the European Commission. Over to you, Madam.
Thank you so much. And can you hear me? Can I have a little thumbs up that you can hear me? Okay, very good. Thank you. So I'm very happy to be here, and it's been very interesting statements coming through today. So indeed, I am responsible for the health part of the Horizon Europe program, you know, the new 7-year research program at EU level. And this new program, Horizon Europe, is quite a break from the past. Because we are now operating with quite the different ways than what we have done before. So first of all, this program is really impact-oriented, and it's really impact-oriented investments in research and innovation, and in areas which are really of a high priority for the European Union. So the health cluster is based in the second pillar of Horizon Europe, and this is the pillar that deals with the global challenges and industrial competitiveness. You are probably aware that there are 3 pillars. So you have one pillar which is more dedicated to the European Research Council and also to the Marie Curie Training Fellowship, so more the bottom-up approach. And you have the third pillar, which is the European Innovation Council, which is also a bottom-up approach. And cluster the second pillar and the clusters in the second pillar are really focused to address the political and societal priorities that we are currently having on the table. There are many of them. We have many needs. Of course, the most immediate one is the recovery of the COVID crisis and prepare for the future. Public health crisis. We have the green and digital transformations because we must make sure that Europe is more resilient and also more competitive. Of course, we have the European Green Deal to make Europe climate neutral by 2050, and this also includes zero pollution. And we have quite a lot of work to do on environment and health. There is a very close link there that we need to look at. I have heard the European Health Union being mentioned several times today, and which, as you know, is currently limited to cross-border health threats, cross-border healthcare, and in supporting member states in their health policies and health systems. And there are a couple of really important initiatives that we are also supporting from the research and innovation side, such as the European Health Data Space, Europe's Beating Cancer Plan, the European Health Emergency and Preparedness and Response Authority, the new kid on the block, HERA, that was announced the other week. We also have a new working approach in the planning and programming. So we are, first of all, we're working on 4 years sort of strategic plans that orients our work in the biannual work programs that we have. And we are really co-designing this program with stakeholders and with citizens. And here we have had many stakeholder consultations to feed in. And we have also, of course, the European R&I days that we are using to collect input to guide us where to go. We are also working much closer in the Commission between the different policy areas. And I think health is an area which is very important because I think that we are working with almost all the Director Generals across the Commission in terms of identifying the right priorities and how to make sure that the research and innovation that we are funding also are supporting the policies. So also we have a very strong working approach in terms of collaboration, and in particular I would like to mention in particular the open science and open innovation approach as concerns the data sharing and also the sharing of results, and also the citizens' engagement, that we also want to get in contact and understand much better what do citizens expect in terms of research and innovation. I have heard several also making comments about the need for synergies and complementarities, and this is incredibly important. There's no point that we continue to invest in research and innovation unless the results are taken up for the benefit of the citizens. So we are also working very closely with other programs in the Commission, but also this also needs to be strengthened at national levels to really make sure that we can create what we call pipelines in terms of, from basic research to translational research, and then to foster the uptake, to pilot demonstrations into health systems, etc. So this is really, really important. Some of the programs I can mention that are really important for us is, of course, the EU for Health program, the Digital Europe, InvestEU, and also the European Regional Development Fund. But of course, also this is very important to strengthen at national level to make sure that we capture the many research results. And we are still in this European paradox that we are really scientific leaders in many fields in the area of health, but unfortunately, a lot of the exploitation are being done elsewhere. And we really need to come, to a point where we actually take this back. So this is really a joint responsibility for all of us. I want to mention a couple of specific sort of initiatives and examples which are really important for us. And yesterday was a very big day for us because it was the day when the 5 missions in Horizon Europe was announced. And as you are well aware, one of those missions is in the area of cancer. But also the 4 other missions are also contributing to the planetary health and the European Green Deal, and of course also the new European Bauhaus initiative. The cancer mission, which is maybe the closest to you, but there are health aspects of all the missions, so you really need to look into all of them. The Cancer Mission has as its goal to improve the lives of the more than 3 million people by 2030 through better prevention, cure, and quality of life. And of course, this Cancer Mission is working very closely with the Europe's Beating Cancer Plan. And we have here also set up a joint group with member states, including both research and health ministries. And this is something that we have worked very closely with our colleagues in DG Santé on, that we are trying to bring together these two different sort of fields much closer in view of improving the connectivity and to make sure that the research results are also taken up into healthcare. And we really would like to see this also being fostered much stronger at member state level. So the approach of the Cancer Mission is really to improve the cancer control and also to put citizens and patients at the center of the research and innovation, and to give research and innovation a central role in the new policies in supporting the Europe's Beating Cancer Plan. So from the Horizon Europe program, we have foreseen to provide 378 million in seed funding for the period from 2021 to 23 to support the implementation of this particular mission. And some activities will be to implement a strategic research and innovation agenda to better understand and treat cancer and to improve the quality of life of patients and their families. To establish a high-level collaboration within the cancer community to support a network of comprehensive cancer infrastructures, set up the EU platform Understanding Cancer.eu, it's called UNCAN, and also to create the European Cancer Patient Digital Center. So the first calls for the missions will be launched early next year. They are currently in the late stage of preparations. And I would invite you all to have a look at the missions website, because this is where you find the implementation plans for all the 5 missions. And as I mentioned, there are health aspects also in the other missions, so please do have a look. Several of you have also mentioned partnerships. It's something really important for us to work in partnerships with member states, with global actors, and also with the private sector. I have heard rare diseases being mentioned several times, and here we have a fantastic international cooperation called IRDIRC, and we have also a very strong partnership at European level. The European Joint Programme on Rare Diseases, which has brought together 130 institutions from 35 countries. That is really impressive. And it really brings together the research community with the European reference networks, and also in terms of data collections, sharing of patient registries and access, etc. It's really a fantastic collaboration, and that we are looking forward to continue to support in Horizon Europe. I want to mention personalized medicine. It has also been mentioned previously. Here we also have an international consortium for personalized medicine that we are also supporting with a partnership. And the international consortium is also bringing together more than 50 partners. And what's really important with this partnership also is that we start to see that many countries are represented both by research and health policy authorities, and also regional authorities. And I think this is really important because, as we know, in many countries, the implementation of health is also delegated to regional levels. So this is a very interesting collaboration, and it has been mentioned here as well that cancer has, of course, been one of the pioneering areas. We would like to see also here a future partnership also making good progress on personalized medicine in other areas, and also to in particular look at the economic and socioeconomic benefits of a personalized medicine approach, and also very much look at the prediction and preventive side, because we feel that this area is really lagging behind a little bit in the personalized medicine approach. Something else which is completely new for us is a new partnership that we expect to launch in 2022 on transformation of health and care systems. Now, this is also a new public-public partnership between research and health policymakers. from member states, associated countries, and of course us in the Commission. And this partnership aims to facilitate the uptake of health innovations, contribute to the transition towards more sustainable, resilient, innovative, and people-centered health and care systems. And this is also very important, and it's very interesting because it's the first time we also see a lot of health authorities coming forward to collaborate around new models of implementing healthcare. We have, of course, two very big, what we call institutional partnerships coming up. We have the Innovative Health Initiative, which is a partnership with the health industries. It's a successor of the two IMI we have had. IMI has been focusing with the pharmaceutical industry. This new partnership is with the whole health sector. So also including the digital, the medical devices, diagnostic and imaging industries. So that will be a new partnership that will very much focus around the trends that we see very strongly with the integration of different technologies to improve the management of individuals' health. And of course, presents a lot of challenges in terms of regulatory systems, harmonizations, and also how do we roll this out into healthcare. And we have the European and developing countries clinical trials partnership that. Yes?
Is it possible for you to conclude, because we have a lot of
questions? I
am
concluding. I just have one more sentence and I will be done. But I was given 10 minutes, so I hope I kept my 10 minutes. So.
I'm sorry, but we have a lot of questions. So.
Oh, I'm sure you do. But I think it's important that I conclude with the important part. So EDCTP is our partnership with Africa, very important partnership to further support the many neglected infectious diseases that our Southern African partners are suffering from. And of course, we have the Pandemic Preparedness Partnership, which is now in the preparations, and that will be a very strong contributor to HERA, the Health Emergency Preparedness and Response Authority that has recently been launched and is currently being set up. It has a very wide scope. It's not only dealing with biological threats, but also with chemical, radiological, nuclear, environmental threats. And it's just in the starting blocks, and of course will be governed together with the member states. And we are very much looking forward to see this one rolling out. And research and innovation will have a very strong impact and contributions to give to this partnership. And with this, I will close. I'm sorry if I was a bit long, but there is so many important things to say.
Thank you very much. Thank you.
On va passer à des séries de questions.
Voilà. Let us move on to the questions, knowing that many questions have been sent by the audience, both in person in the room and from the internet. If I may, can I shoot a first question, and then we will take the other question, including Reza's questions. A point, I'm not too sure whom this question is addressed to, but I understood, including from what Olivier Véran, French health minister, said, that you emphasized the One Health program. We didn't speak so much about the One Health approach this morning. Is it something which is important for you? And if so, how do you think that in France and in Europe we can implement the One Health concept? I suggest we take up several questions, and then you will provide answers. There's a question as well on the attractiveness of the careers and vocations for young researchers, for the students who are engaged, PhD students, how to attract these people towards research career paths. Other questions? Please, if you have questions, come to the front and a microphone will be given to you. I have several questions, in fact. Just with respect to the One Health, you will be responding at the end of the after the questions are being asked. I have several questions. I would like to thank those asking them. How much should be spent in curative and preventative approaches? In other countries, there is no CNRS organization. There are no organizations like CNRS, but the universities are taking the leading role. We have the impression that there's a brain drain, that the US, for example, are leading the game? What are the consequences of Brexit on research innovation? This is a question to John Middleton. This is the first series of questions, and we have more. Let us stop here and get the answers. There was a person who wanted to ask a question as well from the audience. And then we will suggest that Martin Hirsch can take the floor because he'll have to leave us very shortly. Thank you for giving me the floor. I wanted to pick up on what you said. My name is Nathaniel Marguet. I represent a group of students who do research in addition to studies, and I also work with the European Association of Medical Researchers. In fact, medical and health-related research needs money and needs training and education, and a double and a twofold training and education in both medical sciences and research sciences. So basically, it requires that there is a research dimension in education with motivated and engaged students. Well, it so happens that in France we have a number of education pathways with a twofold curricula, both in health and medical sciences and research, and there are a number of universities which are engaged in these double curricula, and it would be a good idea to have these double curricula developed in the European arena. There is University of Milan in Italy, there's the Lisbon University, and there's the Swiss universities and the UK universities coming up with these double curricula. We would like to see this extended across Europe, and the Symposium here sounds like a good place to advocate this. Martin Hirsch, yes, indeed, I will be forced to leave you very quickly to pick up on the last question. Having benefited from this double curricula, normal, superior, and medical studies, even though I didn't do much of my diplomas and my education, but it's great as an education with people who are both practitioners and doctors doing research and medicine. And for those of us who underwent these training pathways, this is of great interest. With respect to attractiveness of the professions, we need to be aware that aspirations and plans and desires of youth are totally different from when we were young. They're asking for exciting things to happen within the next 2 or 3 years in their lives, and then to go on a new round of exciting things for the next 2 or 3 years after that. But they don't want to be told that in 10 years from now you'll access the job as a director of research, and for the next 20 years you will struggle. This is old school, this old time, and in most European and countries and in the US, this is no longer what is presented to youth. If we don't present this to French youth, they will go somewhere else. And what about what was said about One Health and the brain drain? Of course, One Health is of great importance now in the field of infectious diseases. This is obvious. If you want to do prevention, knowing that zoonotic types of diseases in 70% of the cases are emerging diseases, and we have to address the zoonosis and the environmental aspects, and in any kind of diseases, the non-communicable diseases, especially the environmental front has to be taken on board. This is of critical importance, and this part of the research projects and programs we mentioned earlier, the pandemic preparedness plan, which is under development in Europe, where France, Spain, and Italy are paving the way, and both in the research field at the national and European levels, these are taken on board. And I would say that France, and this is what has been one of our strengths, we've been working a lot on these aspects, and there's interaction. With respect to the brain drain question, can you say something about that? Brain drain with French and European researchers leaving France and Europe. I can say something. Well, the research programming law law has been working on this, fighting the brain drain, generating new attractiveness to young researchers, attracting talent. There are a number of mechanisms in the law which goes in this direction. We are fully aware of the fact that we need to work harder in this direction. Let me take advantage of the fact that I have the microphone to tell you, in addition to what Yazdan said, what he described about the emerging infectious diseases and pre-zoonoses have been supported in the so-called accelerating strategy, with One Health focusing on human health, another section focusing on emerging diseases and threats. This part of the conclusions of the Strategic Commission on health industries. We didn't speak too much about the industrial companies and the private businesses. Well, the share and role of the private sphere have to be encouraged, have to be governed, have to be regulated and framed, but this is a challenge. In the One Health approach, this has been an area which has been already identified. And another answer to one question, and then I'll... we need to ask questions. It's a good thing to ask questions and answer them, right? But there was a question from the audience, says the lady. There was a question on what is the linkage between universities and research organizations. It's not true to say that France is the only country when there are research organizations in place. There are such research organizations in Germany, in Spain, in Japan, but the mixed laboratory activities is something which may be specific to France. So this is something which can be extended and expanded. But the question of being capable of prioritizing issues and coming up with a national level and European level view and visibility so that we can respond to specific issues. We need to have this national visibility and view, of course, and there is very active research, excellence driven and excellence seeking research being delivered via the various labs, and this is an area of further work. This might be the moment when we can answer one word on attractiveness. This is a point which is of critical importance, I think, be it in research and in the medical field, in the medical disciplines, the struggle of youth, the description which is given of the PhD students and PhDs and postgraduate students not finding work with a good pay. Well, youth compare and benchmark themselves. I have 25-year-old children, and they benchmark with each other. They know what they can get when they can see that in sciences jobs, in research jobs, the pay is 2 or 3 times less than in other jobs. It does count. If we don't call ourselves into question the way to attract youth, of organizing career path, of regenerating, reevaluating the research jobs, we will lose all these great talent. It will cost money, but it is essential. We are happy that the world took an interest in these issues. Mr. Lombes, yes, Thomas Lombes. It starts with schooling, right? It doesn't start with universities. It starts with schools, primary, secondary, high schools. Teaching biology has to be revamped and rethought if we want people who are eager with knowing and learning and researching. To pick up on what Christian just said, and because the INSERM was mentioned by the person asking a question, what I wanted to say is that it starts with the basic education level, but it's these youth who are educated with this double culture of research and medical sciences, with a wealth of curiosity and talents, they need to be given prospects, they need to be given dynamic prospects, they need to be offered diversified pathways with agility and adaptability. And this is why at INSERM we are working to develop these research gateways with the hospital counterparts to free up time for people to do research and to do treatment, to do therapy, to develop greater and closer connections between the two communities, that is health practitioners and health researchers. And we can do better. Lots of things have already been said with respect to the ecosystem between universities and health organizations. We can be proud of what we have achieved in France. We were able to deliver during the crisis in France. We won't, but we need to build upon our strength in order to deliver in the international arena. There's one thing with respect to preventative and curative approaches. It is of great interest. I tried and approached these aspects when I spoke about the continuum, which I wanted to highlight. Off the cuff, we are spending some 8% of our health expenditures on preventing and 92% on curing. When you look at the number of years in good health, when you focus on preventing, the upside is much bigger. At INSERM, we have the goal of working on public health programs by strengthening prevention and preventative mechanisms in order to feed into the development of new practices. And the person spoke about the connections between EPST and the universities, right? Are there other questions?
Oui. Peut-être le temps où vous prenez votre micro, juste renchérir sur ce qui vient d'être dit, parce que en tant que responsable d'une école de santé publique, je ne peux qu'être positivement interpellé, mais je pense que ça nous concerne tous, c'est-à-dire comment on peut aussi redonner tous les éléments permettant de développer de la recherche sur la prévention et la promotion de la santé. Je pense que c'est effectivement un enjeu très fort pour notre pays par rapport à d'autres pays.
On va écouter monsieur, j'ai une deuxième question.
Romain Caillan from the University of Paris and Paris Hospital. How can we protect our scientific production in terms of intellectual property, in terms of data safety, and in terms of communication? Because we can see that it requires a lot of energy and a lot of efforts before we can actually have scientific production being published and set in stone, even if it's on the internet. It's very fragile, faced with a lot of
Comment ouvrir la recherche à de jeunes ingénieurs?
I have other questions. How can we open research to young mathematical engineers who are also a key factor beyond good words and speeches, but in reality, impact of Brexit on EU research? I have a question from
the European Reference
for La Charité. I think the European
comme un excellent instrument
reference network,
européen,
referring to it as an excellent tool.
Alors que ça prend beaucoup de temps.
But it's very time-consuming for universities and hospitals to support and to work together with the workload, and how can we improve the functioning of that European network? And a second question about health data, how can they be integrated in these networks? How can the European health data space can be integrated in the European the ERN. Well, without before I answer, I don't want to repeat what has been said, but what Martin Hirsch said, it's absolutely urgent. Young researchers are attracted elsewhere, and we have to keep them in Europe. European reference networks for challenges posed by rare diseases, and bearing in mind the fragmentation in the European Union, it has been decided to run joint projects. So, to put it briefly, these are instruments that have been they've borne a great fruit, but on a high budget. And I think that's what
That's what our friend from La Charité probably had in mind. Europe bears a responsibility to finance these European reference networks because it has really created a lot of expectations on the part of patients, and it would be really the wrong signal if the budgets are not improved. The budgets are insufficient. And in France, we were disappointed that no mention of the European reference networks was made. And I think our friend from La Charité probably meant that as well. We're going to ask our European friends whether they want to add something. And what lessons can we learn post-COVID in terms of the European policy that is to be led in terms of research and innovation? But if you want to add something about this, well, yes, from our European friends who are following this remotely. Well, we have very little time because there were questions about data safety, how to involve mathematical engineers more. So we're really coming to the end of this panel discussion. Well, about intellectual property and data protection and communication, it's always a balance that has to be struck. You know, we want to communicate, we want to disseminate results, of course, and at the same time we want to protect them so as to be able to promote them and check them. So there's always this balance to be struck, and Irene mentioned that. There's the dimension of open research, open innovation. So the point is really to open up as much as possible and make better access to data. And the COVID crisis has also demonstrated that as decisions were made during the crisis to open access to results from works and for all people involved. That's important. And also in terms of values, what are the European values that we want to defend in European cooperation? So, for example, European results and the promotion of European results versus results from elsewhere. So, Mr. Alvaro and Mr. Pris, maybe if you want to add anything or conclude.
Peut-être, parce que je vois, il y a donc Didier Samuel et Yazan Yazan-Panan qui voulaient dire aussi quelques mots pour...
But Didier Samuel and Yas wanted to say something. Well, I think we've demonstrated that there was a lot of energy and a very strong will to work and to publish, but it was a bit disorderly. It was not sufficiently coordinated. And we need clinicians who speak to scientists. We need the multidisciplinary approach, and also to favor multicentric works and cross-European and cross-border works rather than only monocentric work. Domenico Alvaro, if you want to say anything, add anything, and Axel Pris will be able to conclude. Domenico Alvaro, did you have any comment?
Yeah, I really appreciated the symposium. I just want to insist on the need of a common European program of teaching people, starting from high school to the medical school, on the culture of health medicine, because this is very important for the next future. Interdisciplinary program where informatics, engineering, and medical doctors are together to teach people on the new technologies. This, from my point of view, is very important for the progress. Thank you very much.
Pour terminer, pour conclure cette table ronde, s'il vous plaît.
Well, to conclude live from Berlin, over to you, Mr. Pris.
Well, this is not a summary of the whole very brilliant symposium, but there was a question about the ERNs. And this is really a big chance and a duty for Europe, because we have the chance to show that things are possible in Europe which are not possible in a single country that's specific for the rare diseases. And therefore, as it was said, it has to be funded properly and made to real success, like the ERC program is. And then these could be two very brilliant pillars of future EU funding, and that should then be extended to research on a broader scale. But I think we have very, very good chances in Europe. We just have to grab them. Thank you.
Il est temps de terminer, si vous êtes d'accord, les présidents.
Time to wrap up, if you agree.
Sur le partage de données,
I'm sorry, but on data sharing, because it's extremely important, data sharing will become the standard. And if we are not present there, we need to protect, but we need to open up. Well, seems you've recovered from being the last speaker, because you concluded, so you played it smartly. Many thanks to all of you.
Je prends l'engagement que toutes
and I hereby commit to taking the questions that you posted and sent, and I will ask Xavier Ducrest de Villeneuve to join us. Thank you very much, ladies and gentlemen, and many thanks to our distinguished colleagues from Berlin and Rome. I said that this symposium was placed under the aegis of solidarity, and we have a short film that will demonstrate this. It's a film about Alliance Urgence. It's a very short video, a short clip.
Avec une mauvaise nouvelle. L'action humanitaire de grande difficile recherche après le tremblement de terre.
D'un camp vers un autre, contrôlé par la coalition adverse, proche de la panique.
Ils risquent de mourir que les garçons.
Ce sont des enfants libres. Nationales, elles ont vu leurs professeurs se faire tuer. Avec simple marchand.
Entre les bombardements, très régulièrement, et des tremblements de violence et d'agression par la Cour européenne.
Alliance Urgence, 6 ONG, un clic, un don.
United faced with an emergency was the slogan of Alliance Urgence. You are the president of this consortium of associations, humanitarian agencies, so very much committed in the field in terms of international solidarity, and I think you are supported by healthcare professionals. Often you call upon them, but you need doctors, physicians, young people to drive that solidarity. Well, thank you very much. And hello, everybody. Alliance Urgence is a consortium of 6 NGOs bringing together Solidarity International, Handicap International, CARE, and others. So we are emergency specialists and globalists. I'm here to ask the same questions that you ask yourselves. And if I may be honest, I was impressed by the convergence of your questions, your issues, and our issues. I'm the president of Alliance Urgence and Handicap International, and the questions you asked are the questions we ask ourselves in the field. And I think we are the connection, the link between what you're doing here and what we do over there. We need the medical world. We need your research, your innovation to relentlessly improve the impact. And Pascal, you mentioned solidarity. I think we talk about Europe. We could talk about the borders of Europe. We don't talk about Ukraine anymore. Afghanistan, of course, was forgotten because Lionel Messi was deemed to be more important. And I think to make that connection is really important. And maybe because of COVID, we've been made more aware of how important international solidarity is. If we do not think of the countries to the south of Europe, we will not find our way out of these crises. We have to think of one health and one earth. Everything you do here in Europe has an impact and repercussions in the world. So we absolutely need to find fora for reflection. The 6 associations under Alliance Urgence, these 6 NGOs are constantly looking for innovation. These crises are more and more frequent. They are more and more serious. Armed conflicts, natural disasters, climate change, and we already see the echoes and the repercussions of all of these everywhere around the world. So we have to be mindful of our medical actions all around the world and the impact it can have. So we'll see you again throughout this conference. So One Health goes hand in hand with One Earth. Yes, indeed. We represent 70 countries, over 10,000 staff, over 2,000 projects. And so of course, in France and in other countries, we compete to raise funds, but when we're in the field, we're together, and we need this solidarity with you and with the other NGOs. Thank you very much, Xavier Ducrest de Villeneuve. Ladies and gentlemen, we'll resume at 2:10 p.m. This second session will be moderated and introduced by Dean Gilles Rod with a conversation that we can't wait to hear between Daniel Cohn-Bendit and Enrico Letta.